Okay, welcome back. Good evening and good morning to those students who are joining from part of Asia like India, Pakistan, Nepal, or any other countries. Okay, so in today's class, what we are going to talk about, we are going to talk about the cardiac medication. So pharmacology. Now, as most of you know, we are doing the cardiovascular system series, right? So this is going to be lecture number 4 in cardiovascular. And remember, for pharmacology, it will take easily 3 classes minimum to cover the all meds in the cardio, because cardiovascular meds, everyone, they are very, very important, very, very important for your exam. I cannot even miss a single drug. Okay. So highly recommended to attend all the classes in the pharmacology because they are very important drugs and usually come every single day in the NCLEX. So let's get started without wasting the time. In the pharmacology, we are going to start first with the antihypertensives medication, right? We do have lots of meds here, but in today's class, I'm going to discuss the some of the antihypertensives, just so you know, and we'll see how much time do we have today, but I'll try my best to do as much as we can. And you do not miss the next part. I highly recommend, if there is a new student on the YouTube right now, you're watching live session in there, or maybe there's a student right now in the Zoom classes and you have not subscribed to the channel yet, highly recommend either subscribe the channel so you do not miss the notification, or either come into my WhatsApp group who is not maybe in there right now. So in the cardiovascular drugs, as I said, the first one we are going to talk about the antihypertensives. Now, antihypertensives, as the name already indicate, like you want to give these medication to reduce the blood pressure, right? And we have so many different kinds of the antihypertensives medications, right? As you can see, we have diuretics, we have ACE inhibitors, angiotensin 2 receptor blockers, calcium channel blockers, beta blockers. So we have different kinds of antihypertensives, right? But mainly, why do we give antihypertensive medication? This is the mainly 4 reason in a patient body you will see. The first condition you will see, if they do have increased vascular resistance, maybe their vessels are just getting narrow, and because of that, the pressure will increase. That's why you want to give the antihypertensive medication to reduce the blood pressure. The second scenario, they do have high cardiac output, right? In the high cardiac output, definitely the more volume will be there, and that can also increase the blood pressure. So that's why you want to give this medication. Number 3 condition is if there is a lot of blood volume inside the body, increased blood volume in such a medical condition. So that's why you want to give this medication. Or the 4 common reason is increased venous return, right? So these are just the basics, but the NCLEX will not ask you these basics. The one I just talk about it, especially if someone is going for the NCLEX, but if someone is preparing for Norcet or the other examinations, then yes, you need to know some basics as well for your competitive exams, right? But why did I discuss this one? Because it's easy then for you to understand any antihypertensive medication for the long time, not just for the preparation of the examination. Then it will also help you when you're working as an RN on the floor. It's easy for you to correlate all those medical conditions with these 4 conditions in there. Now, without wasting the time, let's get started one by one. In today's class, I'm planning to discuss is the beta blockers, and then I'm planning to discuss the calcium channel blocker. Then I'm also planning to discuss the angiotensin 2 receptor blockers, and then ACE inhibitors. 4 medication I'm planning so far today, but we'll see how much time we have in here. Okay. So before we go one by one, I want to make easy for you, because in the exams, most of the time with the exam pressure, it's so difficult to recall which medication does what and why do you want to give those pills, what is the side effect, adverse effects, nursing interventions. So to remember that everything in there, I think you need to correlate these meds with a simple story in your mind, right? So I highly recommend when you're studying these meds together, consider the beta blocker and the calcium channel blocker. Imagine this is family number one, right? Why I'm saying family number one? Because I feel like beta blocker, calcium channel blocker, they're almost siblings, right? Brother, sister, you can say. So I personally think they almost work in the same way inside the body. So it's easy to remember them. Of course, there is a little bit difference between these two, which we will also talk about it today. But when you remember as a brother, sister, or same family member, then it's easy for you to recall in the exam purposes, like which medication does what and why are you giving those medications in there. Now, this is family number one. Now, remember, after we discuss the family number one as a just as imagination, then we will discuss imagination number two, which is family number two. Now, family number two, I'll make ACE inhibitors and angiotensin 2 receptor blockers, right? These two together, think they are brother sisters again, but they're not from the same family member, but they're like a different family members, right? Family members, not like a drug classification, something I'm talking about, everyone. Family member, I'm just using a common language, so you can remember it like, okay, these are the families, these are also families. One person is neighbor to each other, and this is how they work, right? So you can remember this way as well, because this is how I remember it, and I can recall pretty easily with this method as well. Now, the first drug we are going to discuss is the beta blockers, right? Now, beta blockers, we already know they are antihypertensive medication as well. But the beta blockers, they also reduce the heart rate as well. So one thing you want to remember about the beta blocker, if I'll take you on this slide, is the LOL. As most of the students, they know that these medication, they usually ending into the LOL, right? LOL. So like metoprolol, atenolol, propanolol, bisoprolol, it could be any LOL, right? So LOL medication, you can remember like L for low the heart rate, L for low the blood pressure. So remember the beta blocker medications that does both decrease heart rate, decrease the blood pressure together, right? Now, once you remember the purpose like this, and you remember the names of the medication also, like LOL medication comes under this, then the second thing you need to know is like some contraindications, some medical condition where we can give this medication, any caution or something we need to know. Now, if you already watched my previous classes on the pharmacology, I think I posted more than a week ago one pharmacology lecture, which is method to study pharmacology, right? Those students who are very brand new to my channel, highly recommend to watch that video today before you study anything in pharmacology, because I have my own method how to study pharmacology, and that makes easy for me to study any single medication using the same method so I can remember it easily, right? So I'm going to use the same method in here today. And in that class, I already mentioned that do not study mechanism of actions, right? Because this is something also not going to be testing as well in your test. And also in the real life, also nobody going to ask you where is the beta 2 cells inside your body or beta 1, what they do actually, because this is a pharmacist something, not for the nurses, right? So if I highly recommend watch my previous lecture, I give everything detail in there as well. So in today's class, I'm not going to discuss too much action, just so you know, but I still put it on the slide just in case a student need it and they want to see how does it work inside the body, right? So quickly for them who really wants to know still how does it work inside the body. So we actually have, two different type of cells, like you can say receptor, sorry, beta 1, beta 2 receptors, right? Now the beta 1 is actually on the heart. You will see on the heart, right? So when we take that medication, the beta blocker, right, you will see this receptor is going to be activated on the heart, right? And what is the function in there? Decrease the heart rate once it's get activated. Now, once it's get decrease the heart rate, it will further decrease force of contraction of the heart too, because before it was like too much forcing into there, because of high tachycardia. They were not getting enough oxygen, maybe the heart muscles. That's why maybe the tachycardia was in there. And it also delay the pulse conduction as well. So this is the one way how does it work inside the body. The second way is the beta 2 action, which is, as I said, the beta 2 receptors, they will be on the lungs and also on the heart, right? So when someone take a medication, this beta 2 receptor is going to be activated, right, on the heart and also on the lungs. On the heart, we already discussed at the same time, like it decrease the heart rate, contractions, and everything, the force of contraction. But on the lungs, you will see they actually block the receptors in there and do further vasoconstrictions, right? So this is their main purpose. How does they work inside the body? But as I said, those students, especially the one who writing exam very soon in December, January, or those students who especially even preparing for the NCLEX RN examination or NCLEX PN examination, I highly, highly recommend them like not to go too much into mechanism of action because this is not going to be tested, right? Now, once you know the action as well, the second thing you need to know is the purpose, where you give this medication, right? So as I said, this medication basically reduce the heart rate, reduce the blood pressure, right? So you want to give in those cases. So for example, like your angina patient who has a chest pain. So remember my previous session, angina patients, like the heart is not getting enough oxygen, the heart will try to compensate and pump faster and looking for more oxygen, right? So at that time, like the patient will have high heart rate as well. And eventually the high heart rate can increase the blood volume further and increase the blood pressure as well. Similarly, dysrhythmia patients, they will also have these cases as well, high heart rate and high blood pressure, hypertension, right? Migraine headache, especially severe migraine, I would say, or this medication we can also give in case of prevention of MI and even glaucoma also as well. I'll talk about more about the MI on the next coming up slides too, because I have different slide to talk about it. But yeah, glaucoma patient have a more fluid into their in their eye. So you want to reduce the pressure. You don't want the high blood, the pressure to go for someone when they have more fluids in there. So this is how you can see, where you want to give this pill beta blocker. But I'll again talk about the patient list again in my upcoming slide. So maybe wait for that. But where I don't want to give it for sure, like somebody who already have lots of constriction already in there, like asthma patient, and then bradycardia, and then worsening of the heart failure as well. Now, apart from this, you also need to make sure you take some caution when someone is already diabetic. You really want to be careful in that patient. It's not about like they cannot take this pill. They can take this pill, but you want to be really cautious with them because their sign of hypoglycemia is going to be hidden after taking this pill. So the symptom is going to be masked, which you cannot maybe notice sometime, but hypoglycemia is already there. So this is dangerous. So definitely be very careful with the diabetic patient when they're also taking beta blocker at the same time, because sometimes they're in hypoglycemia and we don't know. It could be there as well. So I hope everyone is clear until here. Let me just see a few messages in here on my screen. Yes, Tessie, it will also increase the ICP. Yeah, definitely will increase the blood pressure further and it will also increase the heart rate. Yeah, very good. Okay. I don't see any other messages until here right now. And I have a one message on YouTube. For Ajay Verma. Ajay Verma is asking lecture in Hindi. Ajay Verma, I will try my best to start the Hindi series soon. if you're especially a Norcet candidate writing exam in Hindi. But if you're NCLEX student, I highly recommend English classes for everyone, because at the end of the day, you need to write down this exam in the English. And very simple language, I think, will be used in my lecture. So everybody will understand pretty easily. But especially if someone needs Hindi classes, especially for Norcet, I would say my series is coming up very soon. And then that will be helpful for a lot of my Hindi students. Okay. So apologize for today, but you can always connect with me on the WhatsApp. If something you really want to understand in Hindi, something you don't know, I can explain you personally over the phone also. Okay, just give me a call in there then. Now, moving on back to side effects and adverse effects of the beta blocker, everyone. So side effect is the one, as everybody know, you take this pill to reduce the blood pressure, reduce the heart rate. So if you see hypotension, that is expected, right? And I would say hypotension also can have, like, the patient can also have dizziness at the same time because of hypotension. This is also expected, right? And bradycardia also expected, because you're reducing the heart rate over here. So if you see bradycardia, this is side effect for sure. And then you have the bronchospasm, right? Bronchospasm is definitely, you are also, what do you think? In the chat box, expected or not expected? Side effect or adverse effect? I want to make sure everyone is awake at the same time. Side effect, adverse effect, everyone. Bronchospasm. Let's see your brain. Is it expected or not expected? Side effect, adverse effect. Okay. Adverse effect. Adverse effect. There you go. You're not expecting that, right? Okay. The next one we have is the weakness and fatigue. Okay, expected. The person can feel also with the hypotension, I would say, especially when the hypotension is happening and the dizziness happening at the same time. So this is your side effect. Nausea, vomiting, side effect, and hyperglycemia. Everyone, hyperglycemia. Do you think this is side effect or adverse effect? Are you expecting it or not expecting it? The patient to go into hyperglycemia. Okay, adverse, very good. Because hypoglycemia can be happen, but not the hyperglycemia. Why is it there? So this is your adverse effect. Agranulocytosis, I'm not expecting that again. So this is your adverse effect. And why patient have the psychotic response? Why depression? Why nightmares, right? This is something I'm not expecting in a patient after giving this medication. So I would say all of them are the adverse effect at the end of the day. Now, pretty easy, I think, until here. Now, moving on again to the next slide quickly. What are you going to do as a nurse if you already know that expected side effects or the list of the adverse effects? What are you going to do? So you're going to look at the interventions for yourself. And on the right side of the screen, you're going to teach something to the patient before they go home about this medication. Teaching is very easy if you know the intervention, everyone. Intervention is easy if you know the side effect, right? Or adverse effects also. And side effect, you will only know if you know the purpose of the medication. Because if you don't know the purpose, you don't know what is expected in that case, right? So now let's talk about the interventions now. So interventions, definitely monitor vital signs, very important, right? Especially pulse as well. But here, what I'm going to teach to my patient when my patient is going home, I'm going to tell my patient, how to take vital signs. Do they have blood pressure machine in the house? What is the normal value look like? If they do not have a proper equipment, I will educate the patient from where to get that equipment available. And also I will check if they have enough sufficient amount to buy the machine or not, right? Because this is your job being as an RN. Before the patient go home, make sure the patient have everything available in the home as well, what they do required. And also I will teach the patient, some normal values here and when to call the doctor and what number to call the doctors also at the same time. Apart from this, when you're checking vital signs, pulse and everything, make sure you do some assessments and you do check the patient for signs of bradycardia, heart failure, or pulmonary edema as well, because it affects the heart rate. Now, the second thing in the interventions is you also check the patient for orthostatic hypotension because you just check now the hypotension is expected, right? So make sure you do check the blood pressure in the different positions and make sure when they go home, you hold this medication when the patient is especially severely hypotensive, right? In that case, you really want to also teach the patient, where they should go when the blood pressure suddenly drop down. So I will give them numbers like if it's an emergency, call 911. If it's a non-emergency, please call on this hospital number or line. It depends where the patient live and where you're working as an RN, right? And also, apart from this, I will teach the patient always arise slowly, changing your position, not suddenly. You need to avoid that as well because you do have the expected side effect, the orthostatic hypotension. Apart from this, observe for additional side effect like fatigue, weakness as well. Now, this is you already know because you know the expected side effect. But what you can teach is you can teach to the patient, to report all these symptoms even something in happen in the house. I would say, the when they make this point for the NCLEX purposes questions, I would say even if there is a different symptom, the side effect written here, let's say maybe patient got some fever, some coughing, some pain, abdominal pain, right? It could be anything, right? Even you think that is expected or not, you still need to teach them to report it and especially click that as a right answer, everyone, if it's a SATA question in your exam. It's always a right answer. You always tell the patient to report everything. Doesn't matter what happened after taking the medications. Now, apart from this, in diabetic clients, monitor for hypoglycemia because as I just mentioned that these medication, can mask the symptoms of hypoglycemia. So you want to check for low sugar levels. And sometimes it's not coming on the machine. So please be aware to check the symptoms, sign and symptoms of the patient and make sure a patient is fine if it's not even popping up on the blood pressure machine. Apart from this, make sure they do have a machine at home and they know also how to check it, right? Because if the patient don't know how to check it, you need to demonstrate and get the re-demonstration as well at the same time. Apart from this, I will also teach them about the sign and symptoms of hypoglycemia and not just hypoglycemia. I will also tell them hyperglycemia also at the same time. What could be the symptoms of both and what they're supposed to do if they see low sugar or high sugar at that time, right? Now, apart from this, the next one we have is the observe for the side effects like drowsiness, right? Which is, as I said, expected after taking this pill. So make sure you teach your patient not to do that activities which require a lot of mental alertness. Maybe driving somewhere, right? Or maybe they are doing such a work at home that it does require alertness at that time. So tell the patient maybe to get some rest at that time when they feel the drowsiness, not to work in that way. Now, the last one we have is the measured intake output, measured daily weight as well, which is also required because if they're gaining weight, that is not good with this medication. We need to look into why the medication is not working the way we're supposed to be. But for teaching purposes, you need to monitor them how to take at the weight at the home and what amount of fluid they can take. I would just say plain water, they can take it as long as they're okay to take it. The doctor did not restrict it for some reason. But yeah, adequate amount of hydration is required as much as they can. The standard amount of glasses during the day, like 6 to 8 glasses. So this is the brief information on the beta blocker, everyone. Now let me compare quickly with the calcium channel blocker. And after we do both comparisons, if you still have any doubt, then you let me know in the chat box at that time, okay? Because I'm going to repeat both meds together as well and doing comparison both of them together for you. So moving on to the second med for today, which is calcium channel blocker, right? As I said, remember easily that brother sister of the beta blocker, right? Like from the same family member. Now, Why did I say the blood brother sister in this case? Because it's basically these medications, they calm the blood vessel actually. This is their main purpose. But when they calm down the blood vessel, they actually calm down the heart at the same time as well, as a secondary, not as a primary, as a secondary. But mainly they are calming down the blood vessels as a main thing. But when you look at their function, how what is the main purpose, why we give this medication? I would say the calcium channel blockers, they are actually reducing the blood pressure for sure, number one. The number two is reducing heart rate. It depends which medication you give in the calcium channel blocker, which I'll talk about in the next slide also. At the same time, the different type of calcium channel blocker and in which situation you can give, which situation you cannot give that calcium channel blocker, right? But let's maybe consider for now some common things about every type of calcium channel blocker. The most common drugs we have is the very nice drugs. I always says very nice drugs. V means Verapamil, N means nifedipine or nifedipine, and then D means Diltiazem, right? Now that means if any medication, remember that, if any medication ending into mil, MIL, and any medication ending into dipine, DIPINE, and any medication ending into ZEM. These are three ending words, which you want to write it down maybe for yourself and remember for the test, right? So any medication ending into mil, dipine, ZEM, those ones you want to put under the calcium channel blockers. Just remember acronym, very nice drugs. Why they are very nice? Because they calm down the blood vessels at the end of the day. That's why they are very nice for your body, right? Now, calcium channel blocker, how do they work inside the body? Again, this is a big mechanism of action. I already put the photo in there as well. I can go briefly, quickly, if someone is very interested here to know how does it work inside the body. But if majority of the students here are joining for the NCLEX, you don't need to know, just so you know, because it's not testing for your exam for sure. And even when you work on the floor, they don't ask you these questions as well. So calcium channel blockers, basically they have negative inotropic effect on the heart. So they basically what they do is because of their this property, they decrease the cardiac contraction at the end of the day and basically reduce the workload of the heart and decrease the demand for the oxygen in there. So basically improve oxygen further. Now, how does it work in there? This is normally what happens. So normally what happen is the calcium of the muscles, right? So imagine this is my muscle. I make it up in front of you, right? So imagine the calcium of the muscles is regulated by the amount of calcium ion inside the cell. So this is like calcium ions inside the cell. So how does the muscle contraction work out? How does it control everything? With the calcium goes inside in those in cells in there, right? Now, when the calcium enter the cell through these channels, right, the contraction will be initiated of that muscle, right? But what happen is when you take calcium channel blocker medication, CCB, some student call CCB also. So CCB medication or calcium channel blocker, when you take these meds, they actually gonna block these channels, right? And if they block these channels, they inhibit the calcium from entering into the cell. So you're not going to see the calcium going into there much. So the contraction will be slow down of that muscle basically at the end of the day. Now, CCB cause the smooth muscles in the arterioles to relax. So this is their main function, right? And they also reduce the peripheral resistance and they also reduce the blood pressure. So I can see this is a big complicated medical languages for a lot of students around in here. So that is why I would suggest rather than remembering this whole mechanism of action, guys, because as I said, this is more for your pharmacy exam, but I only bring for those students in here who are really interested to know how does it work inside the body, right? Maybe you're preparing for different nursing examinations, but if you're preparing especially for NCLEX or Norcet, I would say just remember one word. It calms, basically C for calcium channel blocker, C for calm. Calm the blood vessel. This is how you want to remember it. Now, when it has the side effects and the adverse effects, the bradycardia and hypotension is common, is expected because that's why you're giving this pill. Headache, dizziness, lightheadedness, common, expected. Fatigue, common, expected. Peripheral edema. I'm not expecting edema in here. And I'm not expecting constipation as well. I'm not expecting flushing of the skin. I'm not expecting the kidneys and livers is going to be changed enough as well. So all these will be your adverse effect list. And the top one will be, the first three will be the side effects for these medications. Now, the good thing is when I say they are brother sister, so that means mostly side effects you will see is same in this medication, the one you just learned in the beta blockers as well. Even if you can see some differences in here, I would suggest you can add these ones in beta blockers also, and beta blocker ones you can add over here also as well. So this is how the NCLEX usually test as well, because none of the book cover all the points together. But what if I ask you constipation in the beta blocker? The answer will be still same, right? What if I ask you flushing of the skin in beta blocker? Answer will be still same. It's a reverse effect. So you can make up your own list as well if you like it. Now, the next interesting thing is, as I said, when they're brother sisters, interventions is also same. You're not going to see much differences in here, like everything exactly copy paste, because their side effects and adverse effects is almost same at the end of the day when they work in the same method in the body, right? Even the teaching also, I would say it's pretty much same as well. Now, if I skim and scan quickly for all of you, you will see in here vital sign, same point, so same teaching required. So I'm not going to read this whole thing in here, what is in front of me. So what you can do is it's exactly copy paste. Highly recommend when you have this presentation from me or you watch this recording maybe after that as well, you can take either screenshot of this paper or maybe get this actual paper from me on your WhatsApp. So you can study very effectively if you want to print something, but this is exactly copy paste if I say. So observe for changes in the level of consciousness, dizziness, fatigue because of postural hypertension. Exactly copy paste, almost same, right? Because there also you see the orthostatic hypertension is happening in here and dizziness fatigue here is also happening as well. So there's not a much difference. Observe for paradoxical increase in chest pain or angina symptom as well. So yeah, these are the symptoms could be happen if in case you give this medication too much. So these symptoms you want to watch for it. And I would say for these ones, I'm going to teach my patient how do they feel chest pain, what the symptom look like if they have angina-like symptoms at home, what they're supposed to do, which medication to take first, when they should call 911, right? So this is how I will talk about this medication in there. Then observe the blood pressure reading in sitting, standing, supine position. Again, same thing because we did in the beta blocker as well. And then you have monitor for signs of heart failure. Now, CCBs basically increase the risk of heart failure more because it's mainly reduce the contractility of the heart, the myocardial contractility. So that's why this could be more common here. So you really want to watch it out and teach your patient about the sign and symptom list also as well. So on the right side of the screen, this is the one you want to talk about the sign and symptoms of heart failure. And I think we already covered the heart failure 2-3 days ago. So those symptoms which left-sided, right-sided, make sure you do teach to the client what you know already about this medication. Now, apart from this, monitor for the fluid accumulation, right? And do check the intake output, daily weight. This is exactly same point, I would say, the one we cover for the beta blocker, right? And same teaching on the other side as well. I don't really see a difference. And then hypersensitivity reaction. I think this is you can add up in beta blocker, even if it's not in there, because this is a universal standardized point. You always check for it and you teach about this to the client also as well. And kidney liver function you want to check. So this is again same point what you did in the beta blocker as well. And if you did not notice in there, you can add up actually, right? Here is more common kidney liver function you want to check more common in there, but I would say this one you can easily add up in beta blocker, and not just even beta blocker. I would say add up in any medication, because for all medications you want to check the metabolization and how the kidneys also work for excretion as well. So you can add up this teaching point and interventions in most of the other medications also. Now, regarding the kidneys and liver function, quickly on the screen, they said report the signs of nausea, vomiting, anorexia, bleeding, severe upper abdominal pain, heartburn, jaundice, basically anything if happen, you need to report it, right? Similarly, for renal toxicity, right? How do you know renal is not functioning enough right now? When someone has a high fever, flank pain, changing in urine output, or maybe color changes in there, or you see some sediments in there in the urine, or urine may be so cloudy. So just report it in that case. Now, the last one we have here is the observe for constipation, and the client may need an increase in dietary fiber or laxatives as well. I'm just going to make a zoom a little bit in here so you can read it more clearly actually, because it's more at the bottom of the screen. So for the constipation, definitely they need increase in the fiber or the laxative. I make a zoom right now, everyone, and going to the right side of the screen at the same time. So advise the patient, which food I would say I would advise, give the more fiber. And also I will recommend how much fluid to take it. And if they want to take stool softener, they can take stool softener after consulting with the physician as well. Now, the last points they're talking about in here is the client safety and ambulation. You need to monitor until the response to drug is the known as well, because hypotension is pretty common here again. And same thing for the hypotension, you teach about the client to avoid driving and any activity which require the mental alertness as well. So it's exactly copy paste, I would say, like 99%, if I see with the beta blocker. So there's nothing much you have to, repeat interventions and side effects again with this medication. If you already know beta blocker, you should be able to answer calcium channel blocker pretty easily as well. But what is the difference? Let's see maybe on this screen right now. So this is a shortcut. Actually, I write it down. If you want to remember easily in the exam, B for beta, right? So B for beats. That means this is mainly for heart rate, right? C for calcium, C for circulation. So this is mainly for your vessels, calm down the vessels at the end of the day, right? But they both actually reduce the blood pressure, and I'll talk about the heart rate in a minute. So beta blocker is mainly heart protector, as I said, right? And you give beta blocker when the heart is over functioning, and needs some protection, right? So how you can remember it, this is the trick. If the heart is the problem, you see a medical condition there is related to the heart is the problem, then give the beta blocker as a first line of drug in that case. So use beta blocker when someone has MI or post-MI patient. Even I would say prevention of the MI. We don't want the patient to get MI as well. So you can use the beta blocker in that case. Or if someone has a very fast high heart rate, like tachycardia, AFib, SVTs patient, you want to give first beta blocker in that case, right? Because a lot of students I know, they have a doubt. If they're both are brother sister, they both are almost same, then why we give some patient beta blocker, why some patient get calcium channel blocker. So this slide is really good to understand that information in there. So beta blocker is actually also good for heart failure because it just reduces the workload in there and improve the oxygen supply. It's also good for anxiety patients or tremor patients as well because it calms down their heart as well. And it's also good for hyperthyroidism because it controls the palpitations in there. And it's also good, as I said, for patient who has a high blood pressure along with the high heart rate. So both together. So that means someone has a high blood pressure, right? And someone has a high heart rate. You want to give the beta blocker. And these are conditions which you can see with high blood pressure, high heart rate at the same time, right? But remember, you avoid these medication again in asthma patient because it does bronchoconstrictions, in COPD patients also as well. And also remember, if someone already have bradycardia, low heart rate, do not give the beta blocker in there as well, right? So this is more on the comparison slide with the beta blocker in a short way. And I think it's a good slide for revision purposes right before you go for test, right? Now, quickly moving on to the other side, we have calcium channel blocker. As I said, they basically calm down your blood vessels. So relaxing for the vessels, basically, right? Now, this medication, you want to give CCB when you think inside the body in that medical condition, the blood vessels are way too tight, you know, because when the blood vessels are way too tight, the blood pressure can go up. But remember, it depends. You can give this medication either if the heart rate is normal along with the high blood pressure, or if the heart rate is low along with the high blood pressure, right? It's because we do have different types of the calcium channel blocker, which I'll talk about in a minute, right? Now, the memory trick, how you can remember this one is, as I said, vessel is the problem, right? Then you give calcium channel. But if the heart is the problem, then you give the beta blocker, right? Now, use CCB, this calcium channel blocker, in which patient? So this is your list of which patients right now. So CCB you want to use in high blood pressure, especially if the patient has asthma or cannot take beta blocker. So if someone has asthma, COPD, they cannot take beta blocker, you give the CCB in that case now, right? Second one, and someone who has angina problem, like their more coronary vessels are more open up, right? In that case, you can also give the calcium channel blockers as well. I would say angina can go in both cases, like beta blocker and calcium channel blocker also, but it depends what is the heart rate of the patient look like at that time, right? If you see the heart rate is high, better to go beta blocker. If you see heart rate is normal or low, then you go for the calcium channel blocker. The third one we have is the Raynaud disease. Now, what is Raynaud disease? Raynaud disease is basically a medical condition where the blood vessels in your fingers or in your toe, they suddenly become so narrow that it makes you feel like the poor blood flow is there, you know, and it can happen due to very cold weather or maybe due to very high stress, right? So that condition we called is the Raynaud disease. So in Raynaud disease, if you give calcium channel blocker, it can actually relax those vessels. The one becomes narrow due to cold weather or stress. So it's helpful in that case. And hypertension in pregnancy, we prefer nifedipine in that case because I will tell you in a minute, the nifedipine do not reduce the heart rate. Okay, so this is safe in pregnancy if you're looking something in pregnancy. Now, when beta blockers are not tolerated in any of these patients, then yes, you can give the calcium channel blocker as a second line of drug in that case. Now, earlier, as I said to you guys, the calcium channel blockers actually are two different kinds, right? So let me make a zoom on this side of the screen to show you the two different kinds. Okay, here. The first one we have is the non-DHP. And the second one we have is the DHP. DHP full form is dihydropyridines. DIHYDROPYRIDINES. Dihydropyridines, right? So basically, calcium channel blocker, they're divided into two categories further, non-DHP and DHP. Non-DHP are the one which include your Verapamil, Diltiazem. Okay, they slow down the heart rate, remember, along with the blood pressure. So basically, you don't want to give, this medication, yeah, this is slow down the heart rate and slow the blood pressure. Yeah, so you don't want to give in bradycardia. This medication is not recommended because it reduces the heart rate at the same time, right? But if you look for DHP, right, which is the second classification of the calcium channel blocker, in this one we have amlodipine and nifedipine, right? Now, these mainly relax the vessels only. They don't act on the heart rate. That's why these are safe to give to someone if someone has already low blood pressure or someone already has a normal blood pressure. So this is okay to give it to them, right? So, the low heart rate, low heart rate and the normal heart rate. I supposed to say heart rate, but I say the blood pressure, right? So again, recap pretty quickly. CCB medication, number one, reduce the blood pressure for sure, all of them, right? But heart rate, it depends. What is the heart rate of the client? If you see the heart rate is high, give Verapamil Diltiazem, right? If you see heart rate is normal and low, give Amlodipine and Nifedipine. This is better for them, okay? And how you can remember it? Because you must be like, ma'am, this is too complicated. I don't know how to recall this in the exam, right? So this is easy method. See, think DHP. DHP meaning is dilates high pressure, right? Vessel dilator. This is how you can remember it, right? Vessel dilator. It's this dilate the high pressure, right? So vessel dilator dilates the pressure, right? So DHP will be more not affecting on the heart rate because it's just dilates only the vessels, right? Think non-DHP means non-dilating. So they're not really dilating much vessels, but they're more for the heart rate. So you want to give to that patient who has the high heart rate along with the high blood pressure, right? So this is my key difference now between those two medication. I'm pretty sure when you revise these meds, then it will be more easy for you to recall it because, when you see first time too much information, oh my God, beta blocker, calcium channel blocker, right? What they are, what they do inside the body. Or you re-listen this lecture again and again. Even if you don't want to watch the video, just listen me with your headphones. You can still recall a lot in your exam, what the beta blocker does, what the calcium channel blocker does, the calcium channel blocker, or when we can give, these two medications, and what's the difference between both, right? So this is until the calcium channel blocker and the beta blockers. Any questions until here, everyone, before we go to the next medications? And this is the reason, everyone, I want to conduct these classes in minimum 3 lectures because, cardio drugs are very huge, right? So if you study too many meds together in a one day, you're going to mix up a lot and you're not going to even remember much information out of it. So it's better to only do 5 drugs in a one day so you can recall easily as well. Now, any questions until here from Zoom students or YouTube students, or if it's clear, not clear, any questions until here, please, before we go to the next? YouTube also students, any doubts for me until here? Okay. Anyone has any doubt? No doubt? Okay, good. Is everybody still here, awake? All good? Okay, all clear? Okay, perfect. Moving quickly to the next one. The next one we have is the ACE inhibitors, right? And the ARBs blocker. This is more easy. just so you know, as compared to beta blocker and calcium channel blocker. This is more easy. So don't think too much. This is going to be too complicated because this is another easy method. Now, as I said earlier in the beginning of the class, think both of them together as a family member too, just to remember easily in a funny way in the exam. Why family number two? Right? Because family number one, we already discussed the imagination family, like beta blocker and calcium channel blocker. Now, this is your imagination family number two, right? Now, I would say the beta blocker, the ACE inhibitors and the angiotensin 2 receptor blockers, which a lot of students, they call it like ARBs blockers. So whichever you want to call ARBs or angiotensin 2 receptor blockers, right? They both are exactly brother sister. Like I would say just 1% difference, just 1%. So this is exactly same, almost. So that is a good news. So that means if you study one medication, the other one is automatically, you know what it is. So before we start them together, let's see the first thing in here in this colorful slide, because I like the colorful slides, when it's easy to recall something in there. So ACE inhibitors, either you can remember from the ACE, like a ACE card, right? Or you can remember like from the ACE inhibitors, you can say the angiotensin converting enzyme inhibitors, because they ending into pril medication, these medications ending into pril. So you want to remember from April maybe. It's easy to recall that way, right? So ACE, April, ACE, A to A, something like that you can recall it. So for example, we have captopril, enalapril, benzopril, any pril, right? And those who are taking the NCLEX this month, just so you guys know, this is one of your favorite medication. Okay, so be very careful in listening in this class today because this is a favorite medication these days for sure. But I would say that all cardiac meds are important, but you still need to know the ACE ones for sure, right? Now, the next one we have is the angiotensin 2 receptor blockers, which is your ARBs medication. ARBs medication, remember, they usually ending into the sartan. Oh, just give me 1 second. Okay, I think I clicked somewhere by mistake. Yeah, all good. I hope everyone can still see the screen because I just clicked by mistake somewhere. Okay, so ARBs blocker. ARBs blocker basically they ending into sartan, sartan. So for example, candesartan, valsartan, ARBsartan, losartan, any sartan, right? Favorite one is losartan, but you can still remember all the sartan, right? Now, this is the name of the medications in both cases. But what they do, let's see together, they actually reduce the blood pressure. That's it. Remember, guys, reduce blood pressure. One word for both. Reduce blood pressure. They do not affect the heart rate. They only reduce the blood pressure. Okay. That is why I call them family number two, right? Because they have a little bit different role. So they only work to reduce the blood pressure in both cases. Now, how do they reduce the blood pressure or how you can remember them in the exam, right? Again, this is like mechanism of action kind of slide. I really don't want to read this information, but you know what? I feel like this is very interesting to read it. Why? Because if you read this information now with me, you're actually going to remember these two medication for forever. Then you're never going to forget it. Why? Because in this photo, I will tell you how they both work together inside the body, right? So this is, I think, quickly under 1-2 minutes, we can go together. And if you remember it, keep it. If you don't remember it, then at least remember they reduce the blood pressure at the end of the day, right? Now, before we start reading any information in there, I want to show you on the right side of the screen. This is the normal your mechanism, A lot of people maybe they know how does it work inside the body, but those who don't know, I want to talk about that. I think my screen is freezing right now, guys. That's why my cursor sometimes just goes somewhere here and there. Okay, hopefully my screen does not freeze today. So here, okay, why my screen is freezing right now? Okay, I want to take this one down. Give me 1 second, guys. Just a minute. Hopefully now it's gonna be. Okay, so basically, this is the normal phenomena. This is not the medication, okay? One I'm talking right now by looking at this graph, this is the normal phenomena in the body. You know how someone blood pressure increase inside the body, you know? So you need to know that phenomena first. So what happened is your liver constantly produce what? Angiotensinogen, right? And that angiotensinogen basically producing in the plasma, right? At the same time, your kidneys actually, when you have low blood pressure, so imagine right now, if I'm the patient here, I have a low blood pressure right now. At this time, my kidneys is going to activate it and they're going to release one enzyme, which enzyme? Renin enzyme. Now, what is the purpose of this enzyme? The purpose of this enzyme basically to convert angiotensinogen to the angiotensin 1, right? And after it's converting it, at the same time, you will see the blood vessels, from the blood vessels, another enzyme is going to be released in the blood, right? And that basically we have is the enzyme angiotensin converting enzyme, which is your ACE, right? That enzyme purpose is what? To convert from angiotensin 1 to angiotensin 2, right? Once it's get converted, now two things gonna happen here to increase your blood pressure inside the body because two hormones is going to be released. The number one hormone I'll talk about on this side now, aldosterone. Okay, aldosterone hormone will release. This hormone is basically released from where? From adrenal cortex. Remember, there is a adrenal cortex like triangle on the top of the kidneys. That actually going to release what? Aldosterone at this time, right? Now, aldosterone when it's going to be released, it will tell the kidneys, at that time, okay, have more sodium inside the body, have more sodium inside the body. And of course, more sodium is there, the more water retention will be there, the more blood volume will be there, that increase your blood pressure at the end of the day. The second thing we have here is the ADH hormone after we convert from 1 to 2, right? So that ADH hormone purpose is what? And from where it's coming? It's coming from your pituitary gland, from posterior pituitary gland, right? Now, when it's coming from posterior pituitary gland, right, that ADH hormone, again, it will tell the kidneys what? To have more water retention inside the body, right? Once it's have more water retention inside the body, that can increase the volume further as well and increase the blood pressure at the same time, right? So this is two hormones actually which increase your blood pressure normally. I'm not talking about the medications yet. I'm only talking about how normally blood pressure increase inside the body of someone, right? Or either maybe the third phenomena, I would say, the vasoconstriction of arterioles is happening for some reason and they increase the blood pressure, right? But anyhow, when blood pressure increase inside the body, you can give one of these drug at that time. Which one? ACE inhibitor or ARBs blocker, right? Why we choose these two drugs in here and why did we read this information in here? Because if you see the word ACE, right, in here, the one we learned which convert from 1 to 2, when you give that pill, the one I discussed before is the ACE inhibitor. Let me get the pen on the screen. So here, when you give ACE inhibitor, this thing is going to be reduced, right? Or you can say almost no more, converting from 1 to 2, right? So when it's not even converting enough from 1 to 2, what's going to happen? Do you think blood pressure will increase? No, the blood pressure will reduce because you took the oral pill, ACE inhibitor, right? And after you took the ACE inhibitor, this part is going to be blocked out, and that reduces your blood pressure at the end of the day by using the ACE inhibitor medication. The second thing is ARBs blocker, angiotensin 2 receptor blocker. They actually work in this category after converting into two, so if you take that medication, the only difference is they will work in this stage rather than in this stage. So they work in this stage, right? So definitely less production of aldosterone, less production of ADH, and further less production of high blood pressure. So the blood pressure can go down pretty easily. So basically what I'm trying to saying here is like the both medication ACE inhibitors and the ARBs blockers, right? They reduce the blood pressure. They are brother sisters. The only difference is one is working in this one category and the other one is working on this side. I hope it's clear. It's not that complicated, but let me teach you more on this completely. And then you can ask me question at the end after this slide. Okay. So what is the side effect and adverse effect now between the both medications? If I say, so both of them have almost same side effect, same adverse effect. Something which is not same, I already put something in red in color, guys, or something which is not in same, maybe in the star. You can see the star next to the symptom, right? So nausea, vomiting, diarrhea is same in both. Expected side effects. Stomach can be upset, right? But remember, dry cough is common only in ACE inhibitor as a side effect, but you still need to teach your patient to report it if it occurs when they take this medication. Okay. Dry cough is very, very common, but they still need to report it. Very, very favorite question of the NCLEX guys. Please remember that. If you want to remember one thing about the ACE inhibitor for your exam, those who are writing the NCLEX soon, one thing, ACE inhibitor. Don't forget that. Sorry, the dry cough, right? Dry cough in ACE inhibitors. Now, hypotension, again, common in both cases for sure, expected. Now, hyperkalemia, not only in herbs, sorry, it happen actually in both medication, but the only difference is in herbs, you will find it more hyperkalemia chances very easily as a side effect, but in ACE inhibitor, less chances, but it could be still there, that expect side effect. Okay. So the hyperkalemia can happen in both cases. Why hyperkalemia happen in both cases? Because you are giving this medication actually to reduce the blood pressure. When you reduce the blood pressure, you're reducing the sodium. And when you're reducing sodium, the opposite side potassium will go up inside the body. So hyperkalemia is expected. But in herbs medication, this is more expected because herbs medication, they actually work in this side, right? Not in this side. So that is why hyperkalemia more common in herbs medication. Now, tachycardia, expected side effect, and that also happen in both medication. Headache, expected side effect, both medication. Dizziness, fatigue, expected side effect, both medication. Insomnia, again expected in both because some people they don't feel like to sleep enough because of changes in the blood pressure and changing in the volume of the urine, right? So this is pretty much common and expected back again. Bruising, petechiae, bleeding, bad words. I'm not expecting them. Those are your the adverse effect. Abnormal taste, that is common. Metallic taste, salty taste, that is common in both medications too. So again, this is expected in both medication. But remember, angioedema is very bad. I'm not expecting that. This is the most serious adverse effect if it's going to be happen in someone. If you see my this photo on the right side, what happened in angioedema? Big lips and big swelling inside the mouth. So definitely if the tongue is going to be swelled up, that's going to block the airway of someone pretty quickly. That means you need to do something, right? Now, the next one we have is contraindication, where you cannot give these medications. Obviously, when someone has a history of angioedema, remember, this is mainly for your ACE inhibitors. You can write it down, please. This is mainly for ACE inhibitors. If someone has the angioedema, and this is also, sorry, ACE inhibitor, the angioedema that I have mentioned on the top. This is, sorry, not in the both medication. This is in the ACE inhibitors, more common in there, right? Now, this is, if someone has a history of angioedema, definitely you need to report it, right? And definitely you need to stop the ACE inhibitor if it's running, and that patient can go the ARBs medication, because ARBs medications are safe to give if someone has a history of the angioedema. So this is, I want to highlight it because I missed to type on my presentation. So I'm just repeating it for everyone. So if you want to write down into your notes. Now, the next one we have is client taking potassium sparing diuretic, right? Because that retain potassium, spironolactone, right? And you don't want the more hyperkalemia in these cases. So definitely big no. Stroke, active GI bleeding, again, bad thing. You don't want that too. So in those cases, you don't want to give this medication. In pregnancy, lactation, not safe to give it. And if the kidneys are not functioning enough, it's not to save also given that cases. Now, pretty much quickly going on to the next slide. The next slide we have is the interventions and teaching points, right? Blood vital signs, definitely in both cases you will do it. Blood work you will do in both cases too, because you want to check for WBC, creatinine, potassium level. And then you have the hypoglycemic reaction in diabetic patients too, right? This is something very, very common due to increase in sensitivity to insulin. So watch it out. If diabetic patient is taking this pill, again, their symptom can be hidden for hypoglycemia. Mask, it can be done the mask. So you need to watch for the hypoglycemia as well. And Pril's medication, if someone is taking it, especially give them instruction to take before meals. The books recommended 20 to 60 minutes before the meal, and also monitor for bleeding thing as well. I would say in both medication, not just the Prils. So petechiae, bruising, bleeding with the medication in both cases, ACE inhibitors and ARBs. So plus ACE inhibitors plus ARBs medication, which is your sartans, right? So you want to monitor for that too. Monitor for blood pressure reading, which is a part of vital signs, and report the adverse effects to the physician when it's there, right? So this is pretty much simple and easy medication. I think it's not very complicated. If you only understand herbs, you automatically understand if you understand the ACE inhibitors, then you automatically understand the herbs medication, right? The last thing I want to say here is herbs medication are more safely to give to those patients, as I said, when someone has, they cannot take the ACE inhibitors. Why they cannot take ACE inhibitor? Maybe especially they got a lot of coughing or they got the angioedema previously. In those cases, you want to give the second line of drug, which is the herbs. So ACE is the first line of treatment. We usually give it. And the second one we have is the herbs if the ACE does not work in someone. Now, this is all about until the medications here today. I hope everyone find it easy, not very complicated. Now I'm going to look for your screen pretty quickly, see what questions comes on my screen right now, and see if I can answer it one by one as well. Yeah, dry cough, we also need to report as well. Even if it's expected, you still need to report. This is one of the common NCLEX question, just so you know. And someone shared the mnemonics also for ACE medications as well. That's good. Maybe someone like that. You can look into the Zoom chat boxes, please. Yeah, I already mentioned that this is only for ACE. Clopidogrel is the one we're going to talk about in the next session. We're not talking about today. Yeah, this is antiplatelet. Very good. Okay. Because if the blood pressure is increased due to fluid excess, then ACE and ARBs will be given. Otherwise, beta blocker. Beta blocker is the one, Manpreet, if your patient has high blood pressure with a high heart rate. And also in case of an emergency, is prefer the beta blockers. They work very fast. Okay, that's the answer I can see in here. Let me see if there is more doubts in here on the other side. Any other doubts, anyone, or is it clear until here? Okay, I don't see any other questions so far yet. The one question I have on the YouTube right now, someone asked me, I can see here, like why the bleeding could be there. Okay, so the bleeding is actually adverse effect. This is not the expected side effect, and this does not happen because of taking the ACE inhibitors or the herbs medication. This happen if your patient is taking any other medical, the medication also. Let's say, for example, anticoagulants, or maybe they have any other medical condition which cause the bleeding further while they're taking this pill. So this is adverse effect. This is not the side effect. So you're not expecting that. That's why this happened actually in there. I hope I cleared the doubt. This one for Tina. From YouTube, I can see this question. And if anyone has any other doubt, any question for me, feel free to let me know. That's all about until here today. Tomorrow, when we will meet, we're going to continue the another cardiac medication. So please try your best to join the session. If not available, you can always watch my recordings also on the YouTube, okay? And anytime when you revising the meds together, or anything you're revising also from the YouTube sessions, I always tell everyone you can contact me also on the WhatsApp number if there is any doubt, any question, right? Okay, that's it. Okay, thanks everyone for joining the session today. Yeah, perfect. We'll see you guys next for tomorrow, okay? Almost same time. Thanks for joining. Yeah, no worries. Thank you. Yeah.